The administration of medication to a student while he or she is at school should only occur when deemed reasonable and necessary. The school principal and the school nurse will evaluate each request for medication individually in consultation with the student's parent, the Utah Department of Health, and other appropriate healthcare professionals. A form is completed and signed by the parent, principal, nurse, and doctor before medication is dispensed. It is updated each time there is a change in the doctor's orders. Accompanying the form are instructions on how and when to administer a dosage. The parents bring the medication to the school. An account of any pills is included on a log that is maintained. The medication is stored in a secure location, and any unused medication is collected by the parent at the end of the school year. Students with diabetes fill out a form if school personnel are allowed to administer glucagon in emergency situations. Training is also available for employees who want to be authorized to use epinephrine auto-injectors for anaphylaxis. The school nurse or other personnel designated by the principal can administer Tylenol or ibuprofen to students, but permission from the parent is required each time, and those are also added to the medicine log.
A student may possess and self-apply sunscreen. If a student is unable to self-apply sunscreen, an employee may, but is not required to, apply the sunscreen on the student if the student's parent or legal guardian provides written consent for the assistance. An employee who applies the sunscreen in compliance with this section is not liable for any adverse reaction suffered by the student. Students may possess and use only a single dose of over-the-counter or prescription medicine, or enough to cover the period that they are at school. They may also self-administer asthma medication, epinephrine, or diabetes medication if they have a signed form on file at the school. If a student has a medical emergency, employees will contact emergency services and should administer first aid where possible. State law now allows the administration of an opiate antagonist medicine by school personnel. School nurses will provide initial and annual refresher training to available and interested school personnel in regards to the storage and emergency use of opiate antagonists. Each school will make at least one opiate antagonist available at each school for use by any teacher or other school employee who is employed at the school and is qualified to administer it under this policy. State law also allows seizure rescue medicine to be administered by a trained and authorized employee in accordance with the law. Please refer to policy JHCD for more information. In very isolated situations, a child who is terminally ill may be enrolled and actively participating in a public school and may have a do not resuscitate directive. Unless the school personnel are also medical service providers who are bound by state laws in this regard, employees should disregard such directives and should contact emergency services and provide first aid as possible.